Good morning, good morning. So let's do some waving fingers, have some fun. Just wait for Facebook to warm itself up. I'm going in using the live Facebook system, so I thought I'd give this a few days trial to see how the live system went. If you put comments up, it may be that I need to come back later on and answer them. So today I'm coming in because it's something that I feel that, so I've been hearing from various people, let's just say various women, that they are experiencing issues with relapsing moods. And I thought that perhaps that would be a good topic for today. So one of the first things that I want to do is to say that if you have chronic health problems and you raise a hand, not necessarily inside the group, because although it's a private space, you may not want to discuss your own personal health problems, mental health, physical health problems, and it may be that what you want to do is to send me a message. So if that sounds like you, if you think to yourself, yeah, I think what I'll do is I'll just send you a message, Jill. Just drop me a message. I'm a healthcare professional. I'm Health and Care Professions Council registered and regulated, National Council for Psychotherapists and Hypnotherapists registered. I'm a master trainer in neuro-linguistic psychology, coach, and so all of those things mean that I treat literally the information that people give me with confidence. It's not shared with anyone. So if you have something that is bothering you, send me a message and we can jump on a 20-minute call. Having said that, of course, it doesn't mean that everyone can have 20-minute calls every day, because I don't have the resources to do that. I'd love to be able to, but if you actually feel that it's something you need deeper help with, then maybe we can set up some support over a period of time. So let's talk about the topic for today. So the topic for today is relapsing moods. So I've got some notes here, written notes. I always write a few notes down because I think it's helpful for me to stay on track. First of all, in terms of relapsing moods, I have actually produced some information that's out on YouTube. So I will put some links in after I've completed doing this live. And if you want to, you can go and have a look. Some of them have some information about what happens, how you can almost predict that you're going to have a relapse, etc. So let's start with the basics. What we are talking about and are not talking about today, and you are the best judge of how your mental and physical health is in relation to you, because it's all relative, isn't it? I mean, if you've got pain, let's say physical pain, and I've got pain, it's not going to feel the same to both of us. It's going to be different. People have different experiences in life, and so if you're someone who's experienced mental health issues in the past, then you're probably going to have some kind of barometer, if you like, some way that you can actually say, yeah, this is okay, or I'm not okay. I know what I was like. When I was like this before, I ended up tipping right down into deep depression. So what I would say is listen, use your intuition, and actually listen to what's going on. We'll come into that a little bit more in a little time. So, but let's go through some of the basics. Let's just go through some of the basics. We know that your thoughts and your words create feelings. So if I suddenly said to you, wow, these are the winning lottery ticket numbers, and you're like, oh my gosh, you would immediately begin to start to think thoughts and have feelings. Equally well, if what happened is that I told you about, death in the family or someone close to you being very ill, those thoughts would immediately start to impact how you feel. But there's also the other side, that your feelings can also have an impact on your thoughts, which is so if what happens is that we're working around, let's say, research, because I like research, I like proper evidence and science, not woo-woo. I'm a very evidence supported, read the core paper, actually see who wrote it kind of person. So research has shown that with something like chronic pain, for example, when people are mixing with groups of other people, they're feeling fine, but then they go and start mixing with a group of other people who are all talking about their chronic pain. And what can happen is that can actually trigger the feeling of chronic pain in somebody else. Because as you start to think about something, you fire off those neural pathways that give you the output of the feeling, and you can have pain from literally being around, listening to people talking about their chronic pain problems. Now, the same kind of thing is going to apply if you're actually around a lot of people who are talking about things that you know are going to likely trigger your low mood. And the reason I mention this is because a lot of times people are on social media, and you might be on social media. I'm on social media a fair bit. And on certain social media channels, there can be a tendency for people to be following like people with the same views and principles. And certainly in America and UK, in America, you've got a lot happening. You've got elections coming up, very strong views. We've got Black Lives Matter. In the UK, we've got issues to do with COVID. We've got changes to do with Brexit coming into force. And it's the same in every country. And so you may find that what you're actually doing is mixing, if you like, on social media and reading a lot of things that people are writing. And it could be that some of those things may begin to start to trigger feelings inside of you. And this is something to bear in mind. So sometimes one thing to do is to actually take a break. Take a complete break from social media. Literally take a break. No switching on Twitter. No engaging in comments. No posting things up on your page about negative impact of things, no discussing this with people, and just have a complete break. Give yourself a complete 48-hour or even longer, say 3-4 days break, and completely walk away from Twitter. See if you can do it. See if you can actually leave Twitter alone, or Facebook alone, or any of the platforms, WhatsApp, whatever you use. Just walk away from it, because if what's happening is that you're actually being around people who are talking about the problems that might be impacting you, then actually it might be a good idea just to give them a break. Leave them all to worry and let them talk, and you go off and do something else for your own health. Now, this is based on research, as I say, so this isn't fantasy. This is something that we know. If you put a lot of people with chronic pain together and they're all talking about chronic pain, you can guarantee people will start to trigger their pain. Now, the other thing about beginning to start to put tips in place is where you are in the process of having the problem that you have. So sometimes people with mood problems can be in a state of denial, if you like. They're actually laughing it off. They're pretending that it isn't happening. I've even come across people who have almost made fun of other people who are having problems, where really, they are struggling. So when you are in that position and state, this is not accepting, it's not acceptance. And that's a sort of place of denial, of not accepting it. So when you actually start to actively appreciate that yes, something is going on, what I would strongly advise is that you decide if you're at that point. And if you are at that point of actually saying, yes, I accept that there is something happening, I'm not going to laugh it off anymore, I need to take action. Because if you don't take action, then you know that the next step could be that you begin to start to slide down. Your mood starts to slide down. And this is important if you've had depression problems in the past or any kind of mood problems in the past. And remember, on a live like this, I'm not going to go into detail, but any of you listening to this will know how you've felt. And some people can have experienced really quite severe depression. Indeed, it might be that you needed to have a course of medication. Some people get depressed to the extent that they have to take pharmaceutical preparations and go for counselling. And a course of counselling might be as short as a group course of 10 sessions, or it might be 22 sessions. And it could be that in the past you've gone through that process. So taking the step of deciding that you are actually going to confront this for yourself and be honest is really important. And I put this in at the beginning because I've worked with a lot of people over the years, and oftentimes what's happened is that they haven't really admitted to me just how bad they've been in the past. And when I say bad, I mean how low their mood has been. And I think there still is a stigma over mental health problems, although I just accept that people do have them and that everybody operates in their own band. However, if you have had problems in the past, and you know you've had problems in the past, and you know that you can just sort of feel that you're going that way, can you make me a promise? And that promise is that you will make an appointment to go and see your GP, as you call them in the UK, or your physician, your medical doctor, and just lay the cards on the table. Literally just put the cards on the table and tell them what's going on, and just really decide to take that action. Because if what they say is, well, you know, you might need to go back on some medication for 6 months, what we know is that if somebody has taken medication in the past, it can actually act as almost like a placebo. But having that appointment, and then maybe here in the UK you have NHS nurses who are supporting practices, you can be referred over to the mental health teams. And yes, there are wait times, and currently there are about 3 or 4 months wait to get one-to-one counselling through the NHS. However, by taking those action steps, what it means is that you've got a safety net. So if you put the simple tips in place, the one I'm going to give you in a minute, if you have a go and you put it in place, you're not putting this in place. I've got a noise coming from my laptop. It's decided it's got a little thing. I think it's a beetle living in the fan or something similar, but anyway, it'll go away in a minute, it always does. So if what happens is that you are aware that you have this history of problems, there we go, it's finished, it's gone, then can you make me a promise? Don't just sit there and wait for things to get worse. Go and talk to your doctor. Make an appointment. Might take a week or 2 to make the appointment, but go and do that. And now we're going to go into the tip. So, as a psychotherapist and a hypnotherapist, I do provide various forms of therapy. Hypnotherapy, cognitive behavioral therapy, an adaptive form of acceptance and commitment therapy, and some mindfulness-based cognitive therapy. And also I use techniques and tools from motivational interviewing, clean language, a lot of tools and tips from neuro-linguistic psychology coaching work that I've done. So what we're going to do today is just to take a very simple step, all right? And what I would advise that you do, if it's okay with you, for me to give you some advice, is just to be real with yourself and to be honest. If you're experiencing problems, be honest with yourself. Accept that you're experiencing problems. Take some action, make an appointment. Because as soon as you begin to take some action, you'll find you start to feel better. As soon as you get some support, you'll feel better. So what's the tool I'm going to give you today? Well, I suggest, in order to complete this tool, that you get some paper and a nice big fat pen. You can use as big a piece of paper as you like. And the reason I like people to use a pen and paper is there's something about the kinesthetic of writing that means that it helps you to draw things out from yourself. It's quite evoking to use paper. And I want you to draw a box like this. There we go, like that, on the page. So you're going to have two columns. Now you might say, oh, I can do this on the laptop. I can make two columns. No, I'd actually like you to draw this out and actually, you know, make it on big enough paper that you could stick it on the wall somewhere. You know, you've got it on the wall there, on the fridge, and you can actually see it. Now on the one side, you're going to have one column. We'll say that's on the left-hand side, so that's on this side. At the top, you're going to write what's worrying me. So you're going to write what's worrying me on the top of it. And the other side of the column, the top of the column, you're going to put the word action. And then in the middle, between the two, like that, you're going to put a Q, which stands for question. Now, I'm not going to spend all the time today leaving you to write down your list of what's worrying you, because you can listen to this again as a replay, and you can actually choose to do this in your own time. So when you begin to start to have these thoughts during the day and things are worrying you, the best thing to do is in a bullet point format, so not long writing, not like a journal, bullet points. So for example, if you've got worries over your health, just put bullet point health. If you've got worries over transport, bullet point transport. If you've got worries over family, bullet point family. So use small identifiable bullet points in order to be able to access the bigger story, so that it's easy for you to actually list down here. There are obviously going to be things that you perhaps are worrying about related to you. There might be worries associated with your family. You know, if you've got children, it might be you write down son or daughter or aunt or uncle or mother or father or whatever. So just spend time collating what is going on here. Simple as that, right? So get it out. Get it out. And this will do a few things, because if you do go and see your doctor, then you'll have a pretty good idea of what it is you can tell the doctor that's going on at the moment. So you write a long list. Take as much time as you like, but don't go too much into depth, because remember, if you spend all your time writing down all the negative things, what's that going to do? It's going to make you feel horrible. So as soon as you think of something's right, yep, jot it down, jot it down, jot it down, jot it down, jot it down. Okay, so once you've got your list, I want you to do something. And that is where the Q is here at the top. The first thing you're going to do is to ask yourself a question. Okay. So whatever you put down there, ask, is it true? Now, as you go into the problem, let's say you're worrying about, I don't know, the virus that's around right now, and you're worrying about whether you'll catch it or, you know, what will happen. Ask yourself, is it true? You know, is it true as you go through your thinking? Because sometimes what can happen is thinking can sort of run away with you. So you can end up that you're way down the road talking or thinking about something that might happen, and actually it's not really like now. Yes. In fact, it's good for me as far as I'm concerned. If I look out the window and it's quiet, it's like, well, that's good. People must be staying indoors, keeping away from each other. Sounds good to me. So is it true? That's a very deep question, and one that actually you can spend a lot of time thinking about. But is it true? And if you say to yourself, well, yes, it is true. Yeah, it is true. You know, I've got married, let's say you think to yourself, I've got money worries. Yeah, that's true. You put a little tick. Yeah, that's true. I do have those. If you think to yourself, I've got worries about where I'm going to live in the future. It's like, okay, is that true? And it might be, well, yes, but okay, so that's something which we can put a time limit on. But then it might be that the next phase comes into play. So when you ask yourself, is it true? So when you're actually going through this thinking, at what point it becomes something that is really a fantasy? You know, what might happen is starting to get to be a nightmare. The next question to ask yourself is, two questions. What can I do, and is it in my control? Now, there is a lot that can happen in the world that is outside of our control. And we can spend a lot of time talking about things that might not be within our control. If you're reading on social media, oftentimes there is a lot written down about things that really are outside your control and actually don't impact you on a day-to-day, or maybe they do. However, writing down, is it in my control and what can I do, is a really important question, because if something is not in your control, then the best thing to do is not to think about it, because there's nothing you can do. If there really is nothing you can do, then it's not something that needs to be in your thinking. Not right now, if your mood is dropping anyway. But if it is something that there is a bit of control there, and it's like, well, what can I do? Well, that's why in the chart there, you've got a section and it says action. So in that action box, you write down what's the best next step. So the best next step for you to take. All right, what's the best next step for you to take? And if you're not sure with that, so supposing you are worried about the environment or plastics or who's going to collect the bin or I don't know, then once you've worked out that it's something that is inside your control, there is something you can do about this. And the question to ask is, well, what would you like to have happen? Now, what would you like to have happen as an outcome? And what's the first step you can take towards getting that outcome? Because once you've taken that step, that action plan, and you know that it's done, you can tick it on your list. And you know that you're one stage closer to where you want to go. If what happens is that you start thinking, well, there are a series of action steps that I need to take, then the important thing is to actually write those down as a series. And then to do the first one, tick it off. Once that one's done, you do the next one, and the next one, and the next one, and the next one, and the next one. So the reason that you do it this way is no different from, say, doing some housework or cleaning the car. You have to get everything organized before you want to get the job done. And then you work through it in a logical, methodical, sensible way. So if you have a problem that's worrying you, and you recognize there is something that you can do about it, writing a list of the action steps you can take is a great way to feel that you've done something, and it can lift your mood. Because once you've done something, then the problem changes. And it doesn't have to be a big thing, it can be a small thing. It might be talking to somebody, getting some advice. It might be, I don't know, but think about what it is that can be the action step, because as soon as you begin to start to take action and you write it down, one action leads to another action. So for example, if your mood is very low and you've had problems in the past, and you think, actually, maybe I should book an appointment with my doctor or physician or nurse or psychiatrist or therapist or counselor or coach or whoever, pick up the phone and do it. Because once you've done that, you can tick that off. And then you've moved forwards. So put some comments in below and let me know if you put this in action, because I'd be really interested in hearing how you get on. I'll be leaving this in the group as a resource for all of you. And do share if you think it would be a helpful tip for somebody else. Pop a comment in below if you're a replay viewer and you come in later on and you watch it through. And if you'd like me to put a link up to my YouTube channel, pop a note in below and I'll put a link into that as well. So have a lovely day. Take care. I love you very much. I'll go and check on my phone and the rest of it just to see if anyone was live. Sometimes it doesn't show up, anyone was on with me. So have a lovely day. Take care and take action. Love you. Bye.